that we're asking for, but we have three core that I'd like to kind of talk a little bit about today. And the first is a public model of childcare. So structural reform of the system is absolutely essential. A fully public funded and delivered system of childcare must be a priority, and the government must outline clear timelines and plans to develop initial public provision in 2026. An additional 300 million is what we are calling for in our budget 2027 to do this and to reduce costs for families. So if we're still waiting for budget 2028 to see funding, a huge opportunity will have been missed. Now, already this morning, we've had a lot of immediate attention on our public childcare piece, which is really, really good to see, because the more pressure that we can put on, the absolute better. The second of our three core asks is about tackling energy poverty. So we would like to see an introduction of targeted energy credits for households most in need. So we'd like to see an increase of €5 of the fuel allowance per week, and to maintain a 32-week period in which it is payable. So Ireland has the highest electricity prices in the EU, which is absolutely shocking. And we expect to see the cost of fuel to increase by winter time. And as we know, women are at greater risk of energy poverty due to their lower average incomes. So targeted measures for women and other marginalised groups is essential. And we know the targeted measures works. The third of our core asks that we have in our budget pre-submission this year is expanding the free contraception scheme. So the free contraception scheme has demonstrated a really strong uptake and clear public health benefits since its introduction. And what we're asking for is a phased expansion of that free contraception scheme to include all people across the reproductive age, beginning with the 36 to 40 age cohort in 2027. So to do that, government, we would like them to invest an additional 7 million above the current allocation of 48 million to support with that next step of expansion. These are the areas where policy decisions in Budget 2027 can have a real transformative impact on women's lives. So in order to help ground today's discussion in National Women's Council's Key Political Ask for 2027, we are launching a new pre-budget submission infographic, which I believe should be on everybody's screens at the minute. Sorry, I can't see what everybody else is seeing. So this is a clear and accessible overview of our core recommendations and links directly to the full pre-budget submission. God, I can't talk today. For those who want to explore the detail, the link is now being shown on the screen. This one-pager is designed to support members and advocates in communicating the urgency and the opportunity of gender equality to government, but in a clear, concise, and in a colourful way as well. So you'll see alongside our top three asks, we have more political priorities that we are lobbying government around. So our top 10 asks across the programme areas are establishing Ireland's first mother and baby unit. So as many people will know, in Northern Ireland, we have just had approval up there to have one, but we need one in the south. We would like to ensure a full year of pay-related family leave after the birth of a child, which means that a parent can stay at home for that first year, that vital first year of a child's life. We'd like to resource a lived experience advisory council for policy on gender-based violence. And this has come from our observatory report that was commissioned by Cuan and the Department of Justice. We'd like to see joined up policy responses relating to violence against women and homelessness. We know that there is a huge intersection between the two and that one really feeds into the other. We would like to see the introduction of a universal state pension. We would really like to see a pause on the approval of new data centres in Ireland. Figures that are coming out at the minute show that by 2030, 30% of our electricity use will come from data centres, which is absolutely shocking. And lastly, we would like to introduce a progressive tax on the wealth of the top 1% to bring more money into our economy. So these are the top 10 asks. If you have any questions about them, please come back to the team and let us know. We will also be able to send the links to the full pre-budget submission for your perusal at any stage. So today I would like to move on to our panel discussion, where we will now hear from three organisations working at the front line on the issues highlighted in our submission. So each brings deep expertise and lived experience from their sectors, and we are grateful for their partnership and for being here today. So our speakers today are Binta Kyauta Salam from AkiDwA, speaking on childcare accessibility and the specific barriers faced by migrant women. Binta is a legal practitioner and human rights activist with over a decade of experience across Nigeria, Sub-Saharan Africa, and Europe. She currently serves as a project officer at AkiDwA, supporting programs focused on migrant women's empowerment, access to employment, and sexual and reproductive health rights. Her work combines frontline engagement with policy and advocacy. She works closely with migrant women, including those in the international protection system, to improve access to services, strengthen participation, and address structural barriers to equality in Ireland. Binta's work is grounded in an intersectional approach to human rights. She is committed to advancing equality, dignity, and justice, with a strong focus on ensuring that migrant women, including Black and LGBTQI plus communities, are meaningfully included in policy, advocacy, and service delivery spaces. We also have with us today Clare O'Connor from Friends of the Earth, who will address energy poverty and the gendered impacts of this energy crisis. Clare O'Connor is a programme coordinator for Heat at Friends of the Earth Ireland, where she leads in the organisation's work on heat decarbonisation, energy efficiency, and energy poverty. She delivers research, policy, and advocacy to advance a fair transition that reduces emissions, tackles energy poverty, and ends Ireland's independence or dependence on fossil fuels for heating. And lastly, with us today, we have Susan O'Dwyer from the Irish Pharmacy Union, who will speak about expanding the free contraception scheme and what is needed to ensure equitable access across all demographics. Susan is a pharmacist with over 20 years' experience in community pharmacy. She is the head of the professional services at the Irish Pharmacy Union, where she plays a pivotal role in shaping pharmacy practice across Ireland and leading strategic initiatives from across the community pharmacy sector. She is a strong advocate of increasing access to high-quality healthcare in primary care. With extensive experience in the area, having implemented several clinical pharmacy services in community practice and a PhD in the field, Susan brings a huge wealth of expertise to her role. She is actively involved in national and European level working groups that shape pharmacy policy, service delivery, and healthcare collaboration. So to kick things off, can I ask each of you to tell us why this is such an important issue for women today and who is affected the most in each of your areas? So Binta, I'd like to go to you first.
Thank you very much, Corinne, and thank you so much for having us here. My name is Binta. I think Corinne has done a good job with giving a big background on me, so I don't need to do that. But definitely, childcare, we would say childcare is like one of the most important things that undermines women's accessibility to employment, to just being a woman and having a life, having a career, having a job, having goals, having ambitions. And one of the things we have seen definitely is that it's one of the greatest barrier to advancing women's equality, especially in Ireland. There's the major challenge that migrant women experience when we look at, inaccessibility to childcare is the fact that they do not have the informal family networks that their counterparts, the Irish counterparts, would have in Ireland. So this kind of estranges them. And I'm going to, at the end of this, just mention one or two lived experiences of women that I engage with and how this is quite a huge challenge. I speak to a lot of these women when it comes to employment, getting them to, want to set up. All of them come from backgrounds where they have businesses. They're literally entrepreneurs themselves, from their home countries. And then they come to Ireland, but they've lost family connections. They've lost informal networks. They definitely can't afford the private childcare, that is currently available, or if most probably not even available, because most of this is available in certain areas. But when you go to those in the rural areas, those as far away in other counties in the country, that this, these private childcare systems don't consider to be profitable, then we don't have this presence in those parts of the country. So whether it's not just even about accessibility to childcare, it's the fact that these women, especially in those far distance parts of the country, can't even access it at all. It's not just about even the financial empowerment to be able to access private childcare. And this is one of the reasons why we strongly, myself as a migrant woman and as a project officer working with migrant women in AkiDwA, and AkiDwA's vision to support the budget 2027 and the National Women's Council's call that, there should be the additional funding, 300 million funding to be able to support childcare. and support publicly provided childcare, especially to these marginalized communities and women from migrant communities that definitely cannot afford childcare or privately available childcare in Ireland. And just to back this up, I would say there's been research, and I'm sure the National Women's Council is aware of this. There's been research that evidently shows that one of the challenges is that you can see that women, especially migrant women, after childbirth, after their maternity leave, most of them can't go back. The ESRI has, shown that research that most migrant women can't go back to employment after maternity care because they have no one to fall back to take care of child. So this literally takes away, empowerment of women. It takes away, their independence, and there's no it's very hard for you to find a woman, especially migrant woman, that would want to choose a career over a child. And so this automatically, you're subjecting women to, to be able to make a decision between their lives and their children's life, and it shouldn't be. So it's very important that we support the call, to have publicly funded childcare so that these marginalized communities and these women can be able to, to have access and to be able to build their own lives, and have women empowerment, and able access employment and work and build careers. And just to round up, I want to mention um, two key cases that I have handled with migrant women that called and that tugged to my heart when I was speaking to them about, employment. I've met a woman that every time we go to deliver, myself and my team, we go to deliver information sessions to them in their communities. The husband will always come in with the two babies within 5 minutes. Like every 5 minutes, he would always walk into the room and try to beckon on her to say she needs to leave. She needs to leave the room, irrespective of the information or the training that she's undergoing to try to build herself and build skills. Participate in maybe sewing skill training and all that. He would always walk in every single 5 minutes. It had to get to a point in time to call her to leave. And then we had to get to a point in time where we had to stop him and be like, okay, you cannot keep doing this. You need to let this woman build herself. You need to let her network. You need to let her see what she wants to become and how she wants to become. And one of the important things I take from that is if this woman had publicly funded childcare that she could use as an alternative. If the husband chooses not to be available to be able to provide support, she wouldn't have to always have to work out and lose on information, lose on, skills, free skills that were being provided to her and to her other colleagues within that center. Another point I would want to mention is the fact that I also have somebody, a migrant woman, that was literally, and I don't want to use the word carelessly, but I would say deceived by her husband into thinking that if she had to set up a business or go into employment when she moved to Ireland, that her kids will be lost to her and Tusla will come take away her kids from her. And this was because this is a woman that came, she's an entrepreneur. She moved in to Ireland. She had a very good business set up back home in her country, and she moved into Ireland and she thought she could start a business again or seek employment. But that was the thing that was used to deceive her to say no. So I was having a conversation with this woman and I'm saying, you have such a good skills, you have such good ideas. Why don't you want to get into employment? Why don't you want to go start up your business again? And she said, because I am scared. I have been told the social workers will come take my kids because I have no other person to fall back to. So these are two very lived experiences that is very important when we're having these conversations and when we are engaging with the government to understand that this is not just a policy conversation. We're not just saying, please put it in the budget. We are saying there are people that would definitely be affected if this this publicly funded service is not provided. So I just want us to that is how much, AkiDwA is very much invested and sees how the imports of having this publicly funded childcare support in Ireland. So I'm just going to end there. Thank you very much, Corinne.
Thank you so much, Binta. I think you've just explained it perfectly why this is so important. Thank you for that. Claire, if we could go to you next, then that would be great. Thank you.
Hi everyone, I'm Claire. I work for Friends of the Earth on energy poverty, and the reason we work on energy poverty is because we don't realize that a fossil fuel phase out or will happen really without making sure that the furthest behind are put first. And obviously, how we've seen that in recent months is our second energy crisis in the past couple of years, and that's as you said, Corinne. We do have the highest electricity prices in the EU. And we know that the people who that actually impacts most in daily life is vulnerable households, low income households, and women-led households in particular, particularly single parents. And I'll talk in a minute maybe about how those kind of vulnerabilities intersect. But and you also mentioned the data centers. So, the reason we have the highest electricity prices in the EU is primarily because of our dependence on fossil fuels. We've some of the highest rates of fossil fuels for generating electricity across the EU. And that's one of the reasons that we're so exposed to fluctuations in energy markets, because our electricity is generated by gas, and we're kind of at the mercy then of the international markets, unfortunately. But another reason is because we're such a dispersed settlement. So we've really high network charges. It costs quite a lot to actually get electricity to people's houses. And then the third thing is, as you mentioned as well, Corinne, is our data center reliance. And unfortunately, data centers are increasing our energy, they're increasing our fossil fuel use, and they're therefore actually increasing prices for us in our homes. And the people, again, that will impact most is people who are experiencing structural vulnerability. So obviously there's single parent households are twice as likely to be in energy poverty and to be struggling to keep their homes warm as other types of households. But also renters are, I think, similarly twice as likely as homeowners to be struggling to keep their homes warm, to be struggling with energy costs. So as well as kind of what your family setup is, it's also your housing tenure. So housing insecurity and energy insecurity insecurity are fundamentally linked. And if we've someone who's, for example, both a single parent and a renter, they're particularly vulnerable and in a precarious situation when it comes to energy costs as well. And the government response that we've seen so far this year has been to put 750 million euro to untargeted energy support, so tax cuts, which we know more benefit the higher income households and households who are more well off. And I think it's really positive to see in the Women's Council's pre-budget submission the focus on targeted supports, because that is what we need. The ESRI did a piece of research a month or two ago, and they said it would cost 340 million in targeted supports to lift people in energy poverty out of energy poverty. So that's literally half what they've already put forward just this year in the untargeted tax cuts, unfortunately. So it's really good to see targeted supports. We do need to see we need the value of the fuel allowance to be restored. The value of the fuel allowance has not increased in line with energy prices going up, and that will be a really, really, really key thing that we need to see in this budget in particular. I'll leave it there because I know there's a few more questions to come.
You're absolutely fine, Claire. Thank you so much. And it just goes to show that whenever the money is spent wisely and appropriately, it can really have such a huge, huge impact. Thank you for that. And Susan, if we could go to you then. Thank you.
Yeah, absolutely. So I think, as many of you know, the free contraception scheme was introduced back in 2022, and it really was a groundbreaking scheme at the time. It removed one of those really important barriers to access for contraception for women, which was a cost barrier. And it started out providing free contraception to women in the 17 to 25-year age cohort. Huge uptick at the outset from like pretty much every pharmacy in the country is delivering the scheme. Very significant amount of GPs are providing consultations, fitting long-acting reversible contraception, as well as providing consultations for oral contraception under the scheme. And it became fairly obvious straight away that women were going to find themselves in a position that as soon as they reached a certain birthday, they then suddenly aged out of the scheme. So as opposed to it being a clinic. So there's a clinical need, but that clinical need continues as you reach a certain age. So at the minute, the age cohort, so as I said, it started 17 to 25. It gradually increased, kind of it went out to 26, then out to 30, most recently out to 35. So it's now 17 to 35. But when you reach your 36th birthday, and if you're on contraception, you may will still have that ongoing contraception need. You're fertile well into your 40s, as many women can attest to. And there's plenty of women that want to be able to avail of contraception at that age. And we're asking and calling for the age eligibility to be extended, because we know from experience in the pharmacy, people are saying and they're seeing that this is happening in practice. People are aging out of the scheme. There are others that are interested in joining the scheme but can't because of the eligibility criteria. And we feel that if you increase that age, it makes it much more equitable. You're at a point there when women are that little bit older, they still have that ongoing contraception need, but then they may also have other children. Your other panelists have talked about childcare costs, energy costs, all of these things women that are in that age bracket are really experiencing. And then adding on the cost of contraception, particularly at that age cohort, you often see women wanting the longer acting options as opposed to the oral contraceptive pill as their choice for what works for them, particularly if they have a family and a busy life. And those are, again, more expensive options. So being able to make sure that everybody has that access. And I think when the Women's Health Action Plan implemented this, and as I said, it was a groundbreaking thing, part of, I suppose, the idea there was that it would continue to be developed and that eligibility would expand as the need was evidenced. And we've seen the recent study that you've commissioned yourselves and worked on, the National Women's Council in Trinity, commissioned by the Department of Health. So I think the department recognised that there's a need there also. And we feel that this is a logical next step in the kind of evolution of that scheme.
Thank you for that, Susan. And thank you for tying in the other two parts of today's discussion. I think it shows that this all just, it's so intersectional with women. It's not just one or the other. Like women have so many different challenges ahead of them. And thank you all for those really insightful contributions. And it's really important for us to ensure that our work encapsulates these on the ground realities for marginalised women across Ireland. And I'd like to take a few minutes now just to explore some themes that you've kind of raised and how they do intersect across sectors. And I'll come to each of you individually in this. So looking at the current political landscape for Budget 2027, what is the biggest barrier standing in the way of your ask in your area? And do you see any opportunities to successfully influence change in this area? So Binta, I might come to you first of all, if that's okay.
Okay, thank you very much, Corinne. I think the biggest barrier I would see would be refusal to, have this included in the budget. And sometimes because of how much childcare has been privatized, this also can be a bit of difficulty for the states to want to take over the responsibility when it comes to providing these services. And that we have seen that over time, that when a particular sector, a particular service is being privatized, it has quite a challenge for the state to want to be willing, to want to take this up. But we cannot overemphasize that the fact that something is privatized is automatically means it's profit oriented. And when for services like this, when we talk about childcare cannot be looked at from the lens of profit making. Childcare is very much in-depth and intertwined in a woman's lived reality. For women that choose to have children or that choose to, be parents, it's very much intertwined in their lived experiences and their lived existence. And it's not just about migrant women, it's all women specifically. I identify as a woman first before a migrant woman, and I recognize the challenges applies to every single one of us. So it's very important that this is not being seen, that the issue around privatization should not be seen as an excuse for, the government to refuse to take up this responsibility, because this is how you ensure, if we are very serious about pushing gender equality, we're very serious about women empowerment as a government, as a country, then this is a very important step for the government to move in the right direction.
Absolutely. Thank you for that, Binta. And Claire, I might pose the same question to you.
I think one of the biggest barriers when it comes to addressing both like the energy crisis and fossil fuel dependence is the government's desire really to just give us untargeted supports, which is a really inefficient use of public funds and ultimately benefits high income households the most. So I actually think it's a lack of political will potentially Unfortunately, it is the reality of it. They want to get there's a desire to get as many votes as possible in the next election. So therefore, like the political will, I think, for targeted supports isn't there, and that's why it's really important that everyone here continues to really push to make sure that households who are struggling the most are prioritized in any pre-budget meetings that we have coming up over the next while. I also think within the political system, they see the energy crisis right now. They see the really, really high energy prices, and they think that it's just something that's happening at a point in time right now. They don't realize that this is going to continue to happen into the future. But they also don't realize that energy poverty is actually a structural problem that has existed way before the current energy crisis. And it's because of people being on low incomes, because of people being in poor quality housing, and it's because of high energy costs that were actually already there before this current crisis. And it's just when it gets to kind of that crisis peak point that it begins to come into the narrative and the discussion, when that was actually there before. So many single parent households in particular were struggling with their energy bills and were budgeting and were disconnecting themselves from their energy sources to try and save money and living in cold homes. So I think it's on us then as well to really push that this problem, the energy prices might come down a little bit, but this problem of structural energy poverty will not go away. And we need to see much better long-term thinking when it comes to tackling the energy prices, when it comes to supporting people with their energy costs, and ultimately when it comes to getting people off fossil fuels and making sure that our retrofit schemes in particular are targeted to people who are completely left out of them right now. They're quite blunt, I think, in how they define eligibility for free retrofit schemes. And again, tenants in the rental sector remain completely left behind in the climate transition. They've really high rents, but they also now have the really high energy costs as well. So it's important that we've targeted support with energy costs for renters, for example, like balcony solar, like plug-in solar solutions like that. I know that's in your pre-budget submission as well. So looking at kind of new solutions that help those people that to date have been left behind, and noting that even if energy prices come down for a little bit next year, this will continue to be an issue because we're so exposed to fossil fuel fluctuations. Yeah.
Okay, thank you so much for that, Claire. And Susan, the same question to yourself.
Yeah, well, I think given it's a health issue, I think the health budget and the limited funds within that budget are probably the biggest challenge that we have in terms of the ask and getting it into the budget. But that being said, I think the policy direction is there. As I said, the Women's Health Action Plan back 22-23, that was the initiation of this free contraception scheme as it was. We've seen a subsequent plan that has further developed it and increased the age ranges, and we hope to see later on this year a further iteration of the plan. Another thing that's going to be happening later this year, at the minute, there's some legislation going through the legislative process to allow pharmacists to prescribe contraception on an ongoing basis. So where a doctor has issued an initial prescription, pharmacists will be able to continue that prescription for a period of years, actually. And that provides an opportunity actually to have greater access to the free contraception scheme. So patients will access for the first consultation with their doctor, but after that they can visit their pharmacy and they can have their follow-up consultations and prescriptions issued in that location. So then you've greater access, and it's a good opportunity and a good time to be able to say, look, we're making a change to the scheme here. We're providing more access points. We're providing more practitioners and service providers under the scheme. So why not then allow for that access to more women as they age out of the scheme, but also people that maybe never availed of the scheme but would have the opportunity to do so if we increase the age ranges.
Perfect. Thank you, Susan. And one last question, just before we move on to the next part of the session. We all know that issues such as health, childcare, and energy poverty, they don't affect women equally, and that those experiencing multiple and intersecting forms of inequality are often the least visible in policy design. So if your budget ask were to be fully realised, what is the one tangible difference that it would make to the lives of women most impacted by these inequalities? And Binta, I'll come to you first of all. And I think you addressed it in your opening statement, which would be good to hear.
Yes, I think the most impactful would be for have more of this publicly funded childcare situated specifically within environments that have less availability, especially in the rural counties where we have very, very limited availability, or most of the privately available ones are closed down because they do not have space. So if we could have a target, and I think it's one of the asks that's coming from the National Women's Council, if we could have a targeted 50 publicly funded within these rural counties across the country, that can provide the support, it would have a huge impact and, would be very effective coming out from, the budget being accepted.
Absolutely. Perfect. Thank you. And Claire, if I could go to yourself with the same question. So the one tangible difference.
I think if the government were to effectively tackle energy poverty by providing like direct support in the terms of like, direct cash transfers like energy credits or increasing the fuel allowance, and then also improving accessibility to retrofit schemes. I think the difference is it would just take one stress off people. If people are trying to decide how to spend their money, that thing of choosing between heating and eating this Christmas, it would just be one thing that it would take off people's plates. And obviously it wouldn't solve everything. There's still, as we've heard today from my other panelists, there's still so much that needs to be done. But I think, taking that decision of, can I turn on my heating right now when it's freezing cold? Taking that decision off people and allowing people to live in a warmer home, I think would be really, really significant.
Absolutely. Absolutely. Thank you, Claire. And Susan.
I think it, very much like I've been saying already, I suppose the tangible difference, that really one thing, it's just a greater autonomy for women of that certain age over their reproductive choices. So if you've got a woman, she's already struggling with the costs of childcare, of energy, of all those bills, all that life stuff that goes on, then she may have to make a choice around what she can afford in terms of either maybe no contraception or a contraception that is maybe not the most appropriate or the most medically beneficial for her and her stage of life and what she wants in terms of her contraceptive choice. And if you remove that financial barrier, then you've got that autonomy to make that decision without having to worry about that cost. So I think really just making life easier for women, and taking that little bit of financial burden off them, it just helps them to make informed reproductive choices irrespective of their personal circumstances, which I think will be really beneficial.
Absolutely. And so important to have autonomy as well, Susan. I'd like to thank you all for joining us today, to Binta, to Claire, and to Susan. I think you have added something really valuable in terms of our three core asks to really help explain why it's so important that these actions are taken with government. So I'd like to thank you all very much for being with us today. And now for everyone else, I am delighted to welcome Senator Patricia Stephen, a strong advocate for women's rights and someone who has worked closely with civil society to advance meaningful policy change in order to attain greater equality for women in Ireland. So today we'll be discussing the development of the Domestic Violence Travel Supplement, which is a measure included in our 2026 pre-budget submission and carried forward into formal legislative channels, thanks to sustained collaboration between organisations like the National Women's Council and political leaders like Senator Stevenson. This is a powerful example of how evidence-based advocacy, partnership, and persistence can lead to real, tangible improvements in women's lives. And it also underscores, I think it's why we wanted to bring Patricia in here today with us, and why engaging in the budget process matters so deeply. So thank you very much, Senator Stephen, for joining us today. One of the questions I wanted to ask was, like, pre-budget submissions are often one of the main ways that civil society organisations can engage with policymakers each year. So from your perspective, what distinguishes a strong submission from one that might get overlooked? And I know at this time of year, even in social media, like every organisation, they're all heading into Buzzwells or over to the Dáil. And I'm sure these are all just inundated with pre-submissions. So are there any particular types of evidence, recommendations, or approaches to communicating these key asks that make it easier for yourself to champion an issue politically?
Yeah, it's a good question, because we do get, every kind of advocacy group out there will send things through. I think one of the main, like from my perspective, is like, if I think I've been specifically targeted, someone's contacting me, and I know that you might assume that, but I appreciate from campaigners' side, it's actually a lot of additional work to send personalized emails and personalized outreach, but it can make a big difference if you feel that an organization really wants to speak to you specifically because of the basis in which stuff that you've done before. So like if you are talking about healthcare related issues, reaching out specifically to people who've talked about that, or the healthcare spokespeople for the parties and things like that, that's very helpful. And I think, you know, for particularly when you're talking about opposition parties who don't hold all the levers of power, and they're not ministers and they don't manage departments, specific and tangible, you know, something that isn't obviously a lot of what you've already talked about, they're big. Some of the things like around childcare, they are big, and we want a public model of childcare with the Social Democrats, but they're really you need the government to buy into it, and the government and the department to be willing. So of course you can we can keep pushing and advocating for that. But for I suppose for something like the free travel scheme for survivors, like I wasn't under the illusion that it was going to solve domestic violence, but that it would form part of the wider protection system, and having it situated within that context, like this is a tangible thing that can form part of the response, is a helpful way of looking at it. And another big thing I think is for me around that particular scheme was comparing it to other jurisdictions. So places where the scheme was already on offer, and we have loads of examples across Europe of free childcare. We have loads of examples of much more affordable healthcare and things like that in jurisdictions which have a similar kind of income level as Ireland, and we should be matching that. And I think that's a very compelling story, both for politicians but also the public.
Absolutely, absolutely. And that, as I say, is one of the reasons that we were so keen to have you join us today. And it has been the success of the domestic violence travel supplement. So the idea for a travel support scheme for victim survivors was raised by the National Women's Council, and more importantly by our members on the ground through last year's pre-budget submission, and ultimately progressed by you through that system. So what does this experience of how we've all kind of worked together tell you about the value of the budget process as an advocacy opportunity, and what lessons can other CSOs in the room learn from this example?
So I think you mentioned before, or someone did, that it's a reflection, like the budget is a reflection of how the government perceives society. Yeah. And, it really is that. And I think that's the message for politicians to hear, that it's not just some kind of formulaic process that happens every year. It really is a reflection of the society that we want to create. And I think for a lot of political representatives, it is a moment that focuses our own advocacy, because we will be doing, the Social Democrats, any opposition party, and representatives in government will be doing that between now and budget. The people in government will be campaigning with their colleagues, and they'll be campaigning with the ministers that they know for certain things to be on the budget. We will be advocating from the opposition side. So it is a moment that kind of focuses everyone. But I do think that kind of idea of, outreach to representatives that have been following this is a really good way of doing it. And a big part of that, I think, is around, there's kind of elements of good evidence, which the National Women's Council always, a lot of your budget submissions, they're substantial reports. They're really grounded in evidence. You have good summaries as well, so people can just get the headlines, which a lot of politicians will do. They'll be looking through the headlines, and the comms pieces on social media do make a difference, where you can just bite-sized. It's a way of bringing people in, and then they'll go and dig further when when something catches their eye. But I also think it's kind of the change stories. It's the human face of it, which the National Women's Council does very well as well, that kind of human-centered campaigning. And that we saw a lot of that before the last election with the campaign around childcare, and getting, like, the way you managed to get the whole childcare issue on the political agenda so well. Like, it became like a major issue of the election, which it wasn't previously.
Yeah, and I think that we take a lot of credit for that, because I think before that campaign really came to life, people spoke so much about it being an issue, but it wasn't really brought to the political forefront. And I really love what you say in terms of kind of like our reports. We do try and have as plain language as we possibly can. And I know sometimes it's not always possible whenever you're referencing reports and stuff, but the infographic, I'm not too sure if you were here for Senator Stephen, we have an infographic with kind of the 10 key asks at the front. And for me, it's really important that we have that, so people can, at a quick glance, have a quick scan at the page and see very clearly what we're trying to ask for. So that's really, really important. a lot of people would say, and you kind of alluded to it there just with your comment, just that last question, like where government's true values are written in ink, and that's what a budget is, and we've programmed for governments, and it's, it's a sense of what a government is trying to achieve. So this travel scheme proves that when civil society shows up to kind of that negotiating table with undeniable, that real world evidence that you spoke about, that we can actually reshape that ink. So I just wondered as well, like, are there any other gender equality issues that you'd like to highlight as a key area of concern in Budget 2027? And if you'd like to share that with some of the people here today.
So ending the means test for carers would be a massive one. We obviously know women are predominantly, represent the care space. It's one of those we give back tenfold to the state in the free care and labour that's done. And I know the government have committed to removing the means test, but it's something that we would be pushing for to happen this year. Another massive one, we obviously have a huge issue on legal aid in general, which people will be following in the news at the moment. But legal aid as it pertains to survivors of domestic violence, it's still the kind of threshold for accessing legal aid is incredibly high when you know that the legal process is often weaponized, and also financial control is a form of domestic abuse often. There's sort of an ongoing issue from the domestic violence space, I suppose, in terms of housing support, long-term housing support. We don't have enough refuges, but also we don't have enough long-term, refuge is a short-term solution intervention, and we don't have enough supports for people to phase out into kind of more sustainable housing options. And I know we've talked about healthcare already today, but healthcare would be another one. How you access your GP can still be a barrier, particularly for people living in rural areas. I know we talked about the free contraception, which is brilliant, and I have benefited multiple times from the age getting increased again and again. The HRT being free, it was a great, it was brilliant that it came. It was not necessarily very well implemented at the beginning, but great that it's there. But I think, as well as that, just the cost of going to your GP is a barrier. Particularly, I don't know, like the people are familiar with the kind of menopause tax. A lot of women face like additional, like it's 120 or 150 euro per appointment instead of your standard 60 to 90 euro. And again, like if you're living in a rural area, that might be, you might not have transport. You just might not be able to get there as often. So it's all of these, or you might have to drive further away to get to another GP, because the services are so stretched. So the kind of rolling out of on free GP would be a major one, I think, in terms of it's just an ongoing cost, and it affects men and women, of course. But we know that for things like endometriosis, PMDD, like a lot of conditions that are specific to women, they often don't get diagnosed for a very long time. So it actually does take more doctor's appointments. It takes more appointments to your GP, that additional cost each time, to actually kind of even get the diagnosis or get the referral.
Absolutely. And you've mentioned some very big pieces there, in terms of like the HRT, the menopause tax, which I think whenever I first heard about it, I was absolutely gobsmacked by. But free GP, like that's a substantial kind of change that we'd be talking about. And even just from some of the previous conversations today, and it's come up a few times. I know Claire mentioned it whenever she was kind of giving her summary. I wanted to ask you about political will. Do you think we have the political will to make some of these big key changes that we really, really need to see to really progress gender equality in Ireland?
I don't think the current government are ambitious enough, or maybe even have confidence in their own ability to deliver a lot of these things. We had a commitment to Sláinte Care almost a decade ago.
Yeah.
And we are nowhere near rolling it out, for example. So the political will existed at one stage, and for some reason we just didn't implement it, despite everyone being on board with it, cross-party support at the time. So we have a commitment to end the means test for carers by the next election, maybe. Who knows? Small changes get to every budget. There'll be a different change. Perhaps, the threshold was changed in the last budget, for example. But until it's actually rolled out, until we get to that stage, it's just a kind of ambition. And I think we need a bit of vision. You know, there needs to be a kind of vision for a society where we really believe that everyone deserves equal access of opportunity, and everyone, you know, that we have a floor through which, you know, no one can fall beneath. And in Ireland, we should be able to do that. Like we have the wealth in the country to deliver a kind of, you know, a society where there are, you know, affordable public services that benefit everyone equally. Like there is no reason we shouldn't be there. But I think we need to be getting into a different mindset of how we deliver those things. And, you know, we're hearing a lot around investment at the moment, and we need investment in like Irish water, we need investment in transport, we need investment in our grid, all of these big investment things, investment in housing. But we also need to be thinking about how we invest in these public services, you know, that are just as important. We have the hard investment of the bridges and the houses and the roads and, you know, the water systems and the energy systems, but we also need to be looking at this sort of social investment in our childcare, in our healthcare space, in our care work, you know, because, you know, we need both of those things for kind of equitable society.
Absolutely. And I'm going to ask you one last question and pin you down on it, but what are kind of the three big chunky areas that the Social Democrats are working on to progress gender equality in Ireland?
So childcare is a big one for us,
yeah.
Which we call Posta Care. You know, we have a big policy around that, and we'd like to see a cap per month per child, but also eventually rolling out childcare spaces across all new schools so that we're integrating these things, you know, making it normal that you would drop your child off to childcare at the same space as a school. Another big one would be around healthcare. So we are still champions of sláinte care. We would like to see the rollout of free at the point of use, free public model of healthcare at the point of use. Again, there's no major reason we shouldn't be doing this, other than the fact that the mindset in Ireland doesn't seem to be of the government doesn't seem to be moving towards that model in any kind of efficient way. And then the other one would be the means test. Abolishing the means test for carers. It's archaic, it's outdated, and it doesn't reflect the value of care work, which is predominantly carried out by women in society.
Yeah, absolutely. They're three big hard hitters that I think we in the National Council are trying to achieve as well. So anything that we can do to work together and to support you on that, we will absolutely do. And thank you so much for joining us today. I know you were trying to skid up the road as quickly as possible to get on the call, so we really do appreciate you being with us here today, Senator Stevenson. And I'd also like to just say a huge thank you to all of our speakers today. What we've heard really does underscore the breadth of the issues affecting women's equality. And my God, we could probably be here all day talking about many others. And it shows the importance of ensuring that Budget 2027 delivers real, meaningful progress on childcare, on energy poverty, and on reproductive health. Our pre-budget submission is a roadmap for a more equal Ireland, and essentially that's what we are trying to achieve. And it is strengthened by the voices of yourselves who have the expertise, who have lived experience, and who are supporters of the National Women's Council. So I want to thank you all for your continued support, for those who contributed to this work, and to everyone who's joined us today. I also want to say a huge thank you. Please continue to champion gender equality across Ireland. We look forward to working with you all in the months ahead, and for keeping the agenda where it needs to be in progressing a strengthened Ireland. It's up to me to say a huge thank you so much to everyone for joining us today. The pre-budget submission will be online now, I believe. If people want to head over to our website, they will be able to have a full read. I will say go grab yourself a cuppa. It's a long one, but it is important that all of those asks are clearly called out. So thank you all so much, and I hope you all have a lovely day. Thank you so much for joining us.